Hello guys, welcome back to Dr. Arshad Nadeem Awan ultrasound and radiology teaching videos. Hope you're all okay, you're all fine, you're all enjoying your life and everything will be all right on your part. So today I'm going to discuss about the sclerotic bone disease, actually sclerotic dysplastic disease, which is sclerosing and dysplasia of the bone. That is called as osteopoikilosis. Osteopoikilosis is actually sclerosing bony dysplasia, and it is a very rare condition. It is a benign condition. You can find it accidentally, and the second thing is it is always mistaken for the pathology, which is actually it's a benign lesion and it's not basically a pathology, and you can find incidentally on the x-rays. What happens in the osteopoikilosis is bone island. There is multiple bone island or inostosis. It happens around the joint or periarticular region. So this is what happens in the osteopoikilosis. Osteopoikilosis is usually involving the appendicular bone, appendicular skeleton, while axial skeleton and skull is always spare. So it usually you can appreciate on the extremities. What happens on the radiograph, and which point you can pick these multiple bone islands or inostosis can be seen in a clustered form in the periarticular region around the trabeculi. So this is one of the characteristic appearance of the osteopoikilosis. The second thing is it may vary in sizes. It may be from 2 to 10 millimeter, but mind you that it may vary from 1 to 2 millimeter until 1 to 2 centimeter. So it's a variable in size. On the bone scan, there is no activity, there is no uptake on the bone scan, and this is one of the lesion which is called as don't touch lesion. And in the radiology field, this disease, this lesion is called as don't touch lesion. Another spectrum of this disease is called as the one is osteopoikilosis, in which the bone island will appear to be a round, and another spectrum is osteopathia striata. Osteopathia striata, as the name shows, striata, it's the same thing, same disease, but the difference is that the bone island would be in a linear form. When if it is in a linear form, it will be called as osteopathia striata, and if it is in a round form, spherical form, this will be called as osteopoikilosis. So osteopoikilosis and osteopathia striata, how we will appreciate on the ultrasound imaging, on the on the radiographic imaging. So let's start looking for these images to appreciate osteopoikilosis and osteopathia striata. On this radiograph, you can appreciate multiple bone islands clustered around the joints, and these are all parallel to the surrounding trabeculi. However, the quality of this film is not very clear, but to some extent you can appreciate around the joints there are small tiny 5 to 10 sclerotic bone islands. So this is what the characteristic of the osteopoikilosis. In osteopoikilosis, the bone island would be either round or oval in shape. This is a characteristic, and this is one of the lesion on the radiology basis. It is called as a don't touch lesion. So this is osteopoikilosis. Here on this pelvis radiograph, you can also appreciate multiple bone islands around the joints area. Here at the metaphyseal area of the femur neck, you can appreciate multiple tiny bone islands. So again, this is a characteristic of osteopoikilosis. In osteopoikilosis, you will see that there will be multiple bone islands. This would be round in size, or sometime it may appear as an oval. May vary from 5 millimeter to 10 millimeter. Sometime it may get enlarged up to 2 centimeter even, but it's quite rare. So this is what the osteopoikilosis image. So osteopoikilosis involving the upper and the lower extremities, distal part, especially hands and foots as well. So whenever you are looking for, you must look for the osteopoikilosis multiple bone islands appearances, and if it will definitely appear in the round form, in the round or oval form along the trabeculae, around the joint spaces. So this is osteopoikilosis and can be easily picked on the radiographs. Another spectrum of the osteopoikilosis which would be considered, which would be called as osteopathia striata, the only difference between these two is that in osteopoikilosis the bone island will appear round and oval, while in osteopathia striata these bone island will appear longitudinal in linear form along the trabecular margin. So this is the only difference. Otherwise the pathology is same in both, having a bone islands. In one they would be a round in shape, and in osteopathia striatica or striata it would be appear as a linear form. So this was osteopoikilosis and osteopathia striata.